Hello, everybody. Um, so this is going to be the last of the series of adventures in aberrant psychology, and I will get into the reasons why at the end of this long last episode. And although I do have my favorite soda here with me, I'm going to take my last drink of hospital size cola. Hospitally. So yeah, in the past month I've had a bunch of weird encounters that I want to just share with the world and let people know what it's like to be in behavioral security and be a behaviorist, especially in ERs. Where to begin? I'm going to begin just the last night that I had was it was kind of peaceful for the second half, but about halfway through my shift, one of the patients was very not happy to be there. She was on meth, and it was making her very rude and unmanageable. And she asked me to come in, and she was taking all of her leads off that were monitoring her heart and her pulse ox, everything, throwing them on the ground. She's like, "Can I get my clothes? I want to go." And I'm like, "No, you're on a mental health hold." And so she's like, "Well, I want to talk to my nurse." I get her nurse in there, and she starts berating all of us, saying that she's been waiting for hours just for a glass of water. She asked for a glass of water hours ago. Well, I had to point out to her that there were actually 4 different cups of water right next to her on her tray, untouched. And yeah, they were right there. No idea what she's talking about, you know. I was one of the people who got her a glass of water, so it's like, very trying. Yeah, had a little standoff in the hallway, where I'm in the doorway and she's wanting to go left or right, and I'm not letting her through. And so finally, went in bed, and she got a little enhancement from a prescription from the nurse and went to sleep. Yay. But yeah, being told that I didn't get her water when it was right there, that was just so weird, you know? How do you argue reality when it's right there? I had 2 cases this past month that were kind of emotional, I guess. One was a case where I had been told not to tell the patient that I was watching that she basically had her kids taken away. And I was told not to let that patient have a phone because she might call home and figure it out. And it was not going to help her to know that Child Protective Services had taken her kids away, because, it's just going to make her very irate in the place that she's at. So that was kind of awkward for me. I think people normally would want to know something like that, but when it's a mental health situation, I guess, it wasn't my call. I was just told, don't give her a phone. Another one was really, really weird. Girl in her teens. She was wanting to hurt herself, and she comes into the ER, and she's put on a hold. They find placement for her, and then the placement's like, well, Did anything happen with this court case that's come up? These charges that have come up, and it had already been looked at. But what happened was the receiving placement entity was actually talking a completely different set of charges had come up regarding her case, because the stepfather that had abused her decided to counter press charges against her. And it was actually affecting her ability to get placed into a treatment facility until that was, ironed out. Like, was she going to have to actually, go down to the police station or something to deal with this? But it all got ironed out. But basically, to know that there's some pedo abuser out there, who thinks he can shut up his victim by counter pressing charges, it just, Urgh. From outside one of the hospitals that I was in, I actually saw a pileup 2 days ago. And, if you're going to get into an accident, that's a really good place to do it, right outside of a hospital. It was a BMW that smacked into a family-size SUV, and they both smacked into a ambulance. That's in the news. But, yeah, the guy who was in the family SUV, he was actually visiting his daughter who was in the ER. He was just leaving, and then he ended up right back in the same ER himself, with some minor injuries. And I don't know if the driver of that BMW lived. He was in pretty bad shape, broken bones and internal bleeding when I left. But I was watching the cleanup of it. I didn't see the actual accident, but one of the nurses on that floor did. I was watching the cleanup from a patient's room, and later on, that patient, who was in his early 70s but had a lot of dementia, he woke up out of his sleep because he was supposed to get some medications. The nurse woke him up, and he looks over at me in the room. I'm just there because he was a fall risk, and slightly demented, and he might want to try wandering the halls. He looks at me and he's like, "I'm not taking my meds until you get that asshole out of my room. He's an asshole, asshole, asshole." And I did nothing to that guy. Nothing bad. When he, earlier in the night, was not happy with his fish and chicken, because he had 2 entrees, he's like, I want something with beef. I special ordered that guy from the hospital room service a cheeseburger and some pot roast. And he ate that whole cheeseburger up. But something about going to sleep and waking up changed his mind about me. Maybe it's this badge. I don't know. The shirt. I don't know. So there's 2 big stories in this last month I wanted to tell. I'll tell the shorter one first, because it was only one shift of mine. I was tapped to go watch a female patient who was slightly older than me, and she had substance abuse problems with opiates, and she also was thinking about killing herself, or at least said as much, because she wasn't getting her way as far as the doctors prescribing her the opiates that she wanted. Um, so once a patient says the magic words, it's on. You are now, you know, on a med hold, and you're not going anywhere. So I get on that shift, and I'm relieving a nurse who's in the room, who's watching her. And the nurse's eyes get really, really big. And she's like, I thought you were a girl. And I was like, what? Yeah, I'm the bearded lady. Uh-huh. And she's like, no, this patient specifically requested a female watch. And over the course of the next hour, even though other people were in the room, like this patient had a visitor, and the nurses were in and out. This patient successfully got rid of her male nurse, and the charge nurse had to take over. But I talked with her for a little while, and she was okay for a little while, but I don't know. I knew that I was going to have a trainee that was going to shadow me at halfway point in my shift. So I was like, well, I've got this other trainee, and she's going to be a girl, and she'll be here with me. It'll kind of offset the whole ratio of Y chromosomes to pure X chromosomes in the room. And as the night went on, this patient continued to make it clear that she did not want me there. So I called, before that trainee even showed up, I called my boss and I was like, hey, is there any way you can put me on another patient watch somewhere else? Like, pull a CNA from somebody else's watch and put her in here, and then, because this patient really doesn't want a man in the room. And there was no one else. I don't know how that's possible in the Denver metro area to not have anyone else, especially in a hospital with like 800 rooms. There's got to be someone you can pull from. But no, there was no one. And yeah, she cried and she cursed, and I don't know what other people in this equation were thinking, like the charge nurse or my boss, but maybe they were thinking that this patient was particularly manipulative and was actually trying to kill herself, and one of the ways she was trying to do it was get the guard out of the room. Well, how do you get this guard, or get this nurse, or get this CNA, or get whatever out of the room? And so she was trying to get rid of her babysitter, right? And to what end? Maybe she had a way to kill herself that I didn't see, because I didn't have a chance to check the room before she got in there. I don't know if she had something in her personal belongings. I don't know. The room seemed pretty clear to me, but maybe she had some method of killing herself in her mind. I don't know. But I can tell you that she complained so much that it really ruined my ability to have someone shadow me for the rest of that shift when that shadow came on. Especially when about 2.5 hours after that person starts shadowing me, she complains to the nurse that she can't sleep because she can hear a male voice in the room. And it's bringing up memories of past trauma. And I felt for her, this could be a real thing, or she's really, really manipulative. And when I say that, that as a possibility, I say that knowing the backstory of this particular patient, in that she was, prior to becoming an addict, she was a CPS worker and dealt with many cases where there were magic words to be said in the hospital, and trigger things that you can say to get your way. CPS workers are particularly adept at making the law work, and making rules work for them. And that's a good thing in most instances, because they come across people who really do need to be empowered by someone who knows how to get their way, and how to get around loopholes and barriers and whatnot. So for a couple hours that I should have been telling this trainee how to be a behaviorist and how to do patient watches and whatnot, for a couple of those hours there was just silence because I couldn't talk. Because this patient at least got that much done. And then, before I should have been cut loose from that patient, I had a replacement arrive magically at the end of that shift, which also reduced the amount of training that I was able to give that trainee. And I was like, what? They're supposed to shadow a couple people, for a couple shifts before they start out on their own, and here's one that just kind of got ruined because this patient was that that manipulative and controlling of the situation. And I had previously told my bosses that I only like training people in certain emergency rooms because experiences like that don't make people very confident in taking on a job that can be very demanding and very strange some days, But yeah, it really left me with the question: was she actually that much of a misandrist after working in such a liberal profession as social work and child protective services and whatnot? Was she that much of a misandrist that she could not stand me being a man? Like, not just me, her nurse, no one else. She just couldn't, like, make an invisible force field on the doorway and not let any men in the room at all because she just didn't like men? Or was she trying to get the, I guess how she would have perceived it, the easier to manipulate people in the room, so that she could actually try to kill herself, make that attempt, I don't know. So that was really a head scratcher for me, and I know that saying it doesn't sound like it could be possible that the manipulativeness would be present that would make me think this about a patient, but it was there. One of the things that I learned about her situation, though, was very common to a lot of addicts in the opiate realm, and that was that she was prescribed some prescription opiates, and for a while was actually on OxyContin. And after a couple of months, she lost her job and she was not on the same insurance. So she tried to get a prescription through her new um, medical insurance, her new family practitioner and whatnot, and they wouldn't prescribe her the same opiates because they disagreed with the original doctor on the use of such strong things. And so she was left not being able to have her insurance cover the opiates that she wanted to use to manage her pain. And so she was buying those opiates on the black market, and then she realized that heroin was cheaper and did exactly the same thing. And so she switched to heroin. And so while she was hating on me for, you know, being bearded and whatnot, she also was in a little bit of pain, and heroin withdrawal is like the most painful of all the withdrawals. That and benzodiazepines are the two that are really painful. Benzos and alcohol are the most dangerous to come down off of without medical assistance, but heroin is more painful than alcohol is, by far. And it's that pain when you see somebody who just they want to use to get rid of that pain. That pain is like it's the coercion and push and power behind their manipulativeness. They're trying to alleviate a great amount of pain. And so when I say manipulative, I'm not dismissing the possibility that, yeah, somebody just would prefer a same-sex treatment all the way around, and just that was her preference. But I'm thinking, no, it wasn't. It was probably she just wanted to create that little opportunity window in order to get what she wanted. And when she figures out that she can't get it from someone, she figures out a different way to reset who it is giving her her care until she can find what she wants. She doesn't just doctor shop. She care shops, Last story I'm ever going to share with you guys from this job. Last story is, we're going to call him Alejandro after the Lady Gaga song, but mostly because it fits demographically, and I need a name to tell all this. Alejandro, early 20s, Spanish speaking only, and autistic, and developmentally delayed. Alejandro, he would get very angry every time people didn't understand him. Problem is, even with understanding a bit of Spanish on my part, I could tell that even in Spanish, Alejandro does not make sense. And he actually stutters a lot. And says the same consonant over and over and over again, the same syllable. And if you don't know enough of Spanish, you might think that he's actually saying different words when actually he's just stuttering, you know. And you're trying to pick out perfect Spanish. It's not there. In fact, the only person who really understood him was his mother, who would visit him every night after she got off work at her job, wherever it was. I had the pleasure of watching Alejandro seven times. Seven times. And luckily for him, I was a master of connecting to the Wi-Fi. You know, because I don't like using my own data when I'm, you know, in a place that has guest Wi-Fi. In order to connect to a lot of hospital guest Wi-Fi's, you know, you're not really connected until you use your web browser to go to their little I agree web page, you know, that has their terms of service and all that. And in the hospital Alejandro was in, he would get kicked off the internet every 4 to 5 hours because that Wi-Fi system just seemed to reset. His parents had left him a tablet. He watched cartoons on that tablet pretty much every minute that he was awake because you couldn't put the TV on him because he was Spanish speaking and he didn't have much to do in that room. Alejandro was only in that hospital because he could not get placed. The reason why is kind of sad. His father had been a resident alien for a long time with a green card, and he was only a resident of the United States for the last 2 years. But he had been on Medicaid for 5 years, probably with a false social security number, and the nursing home, the facility that he was in, that specialized in high-functioning autistic people, they figured that out. And so he got kicked off Medicaid. Now, he's not eligible himself for Medicaid until 2018 now because of the judgment against him and his parents. They were actually looking into getting him adopted by another family, even though he's over the normal adopting a child range. But because he couldn't get on any insurance with his problems, pre-existing conditions and all that. Yeah, basically after you fraud Medicaid and whatnot, you're kind of screwed. Don't ever fraud Medicaid, people. Bad things. Anyways, Alejandro's parents got a neat idea. Probably they had help with this idea because it's ingenious. They took him into the ER for an infection of his foot, which was actually real. And he actually had a little bit of surgery on his feet while he was in his hospital stay. But by the time I started watching him, the sutures were actually like 2 months old. So it was a while before I started watching him. But anyways, him being an adult, they just didn't pick him up. They can't get charged with child abuse and abandonment because he's not of, child age. He's in his early 20s, but he's not a child. And them being not exactly citizens of the U.S., just residents. They, don't have any paperwork making them the actual legal guardians of Alejandro. You know, so not really any way for them to get charged. So they just refused to be his responsible adults, legal guardians, and sign him out of that hospital. That's how they got him a place to stay away from their home so that they could just go visit him for an hour or two every night. That's what his mom did. In the 7 nights I was there, his dad was there once. But these were not 7 nights in a row. They were over across a month of time. I had him 7 times. Just in the room watching him. He very often would pee a lot. And wet the bed a lot. He would have, in one shift of mine, he would have his bed linens changed 3 times. His mother had basically spoiled him on soda, Pepsi, and she would bring 2 liters in every night because he would get violent if he didn't get his soda. To get this kid to, okay, I say kid, but he's young adult. To get this guy to take his pills that night, it took 2 Pepsis to take his pills. He was very demanding. Didn't really know please and thank you. He knew more. And he had a strange affect with his autism where while he was watching cartoons, he would try to make facial features that they were making, like facial gestures, and it was really strange. And the one that actually creeped me out, I had never seen anything like it. You guys know how people can sometimes play air guitar, when they're listening to a song they like? His mother put on the movie The Lion King, Spanish version, and then there's a song, Hakuna Matata. A lot of you probably know this song. He was making facial gestures as if he were singing. He was just mouthing the words, but they were really weird, like, but no sound coming out of his mouth. And through the whole song, and it really was weird. One night that I was with him, he had diaper rash, and so they didn't put diapers on him. They just put the very large, Depends-like, giant maxi pad-like things. I don't know what you call them, the absorbent blanket. It's about 3 foot by 3 foot. They just put that underneath his bottom, and when he was gonna poop, they were just gonna come in and clean everything. Well, he sprang up in the middle of his sleep and said, "Bathroom, bathroom!" And I was like, "What?" Oh, and then I opened the bathroom door, and he got up out of the bed and shuffled. He still kind of had tender feet from his surgery. He shuffled his way into the bathroom, sat down on the toilet, used it, asked me for toilet paper. I gave him the toilet paper. Wipes himself. Washed his hands, and then went right to bed. And so I'm there in the room for another 10 minutes. And then a nurse comes in to check on him, and she checks under his covers, and then she asked me, did he poop? I said, yeah, he went in the bathroom right there. They're like, what? Because he, for months had been there pooping his diaper and it getting everywhere. And what we learned from this was, if we gave him a diaper, he would poop in the diaper. But if we didn't give him a diaper, he actually used the toilet. He poops where you give him a place to poop. So that solved a lot of problems. They just they kept him in the hospital gown and didn't diaper him anymore. They still kind of protected the bed with the pads and all, but yeah, he got much easier to manage on them once they didn't have to change his diaper. There was another weird incident where he'd blown up a lot at me for every time the internet cut out every 4 to 5 hours, and so I was really good at getting his internet back so he could watch cartoons on YouTube. And when he would get bored of one cartoon, he knew how to push the recommended cartoons on the side enough that I didn't really have to do much in order to keep him occupied. Well, he had stumbled upon some Japanese animes that weren't even in Spanish, but he preferred them over what he was watching, that his mother liked him watching. And it was because there were scantily clad girls in those animes. Now, they weren't Japornimation. Okay, they weren't really bad. They were not even really well drawn, but they were girls that had swords larger than they were, and they had boobs larger than their head. Right? That's what the cartoons were. I don't know what specific cartoons he was watching, but his mother, deeply religious, she took his tablet away. And he was crying. And he was like, cartoons chinados cotatas, and he cried for about an hour. And it was like somebody had taken a normal teenager's stack of Playboys away from his secret hiding spot in his room. This kid really, really wanted his anime with scantily clad women. That was the night that I actually saw his father, who scolded him and it was sad. It was really, really sad. We ended up having to restrain Alejandro, and he was given a large amount of sedative anxiety medication that I wouldn't have gone that route. To me, it's better if someone in his situation happens to see cartoon tatas than, he gets sedated, basically. To me, that was ethically not right. I think that tatas aren't that bad, especially cartoon tatas. I don't care if the young man has the mind of a 4-year-old. He's, gone more than 20 years and hasn't seen real stuff, and if he comes across cartoon tatas and he's attracted to it, let him have his tatas. If it's going to start a fight that gets him sedated, shit. I was not happy with what happened that night. So the last thing I'll say about Alejandro, one of my experiences was I had a trainee who was supposed to shadow me, and in that night he was a little bit needy and he wanted some soda, and they wouldn't give him soda. So he had me push the nurse call button, and he tried to say, juice, juice. I said, I think he wants some juice. And over the intercom they said, okay, we'll bring some in. 10 minutes passed, and he got, anxious, and he just wanted his juice, and so he got up out of his bed and was headed towards the door, and I had to stop him from leaving the room. I put my foot in the way of the door, and I told him, you really don't want to do this because you really don't want to go out in the hallway. If you make it out into the hallway, they're going to give you shots. Remember shots? Remember shots? You don't want shots. And he started lightly slapping at my hands, like, yeah. Didn't want to hear what I was trying to tell him. I'm trying to save him from shots. I don't want to see him go down like that. But because I wouldn't let him open the door, any further, he started to punch me lightly in the stomach. Not so much that it would get me to do anything back to him. It was... He didn't really have all the strength that some other people with developmental disabilities have. He was kind of weak. But the nurse popped her head in and said, what's going on? And I'm like, he really wants the juice. He's getting impatient, and I'm trying to keep him in here, but he wants to go out on a safari looking for more juice. She's like, okay, I'll go get some. Do you need some backup? I'm like, no. I'll just get him in bed. And so I directed him to his bed, and he didn't have to get shots because I didn't make a big deal about it. And that's, I'll give up getting punched a couple times and not making a big deal out of it, as long as they don't sedate the guy. He didn't need that. He needed juice. Okay. So they bring the juice in, and he's alright. Well, meanwhile, that night I had a trainee, right? I had talked with her about the job, and she told me things about her life. Like, she had another competing job that didn't pay as well, and I tried to explain to her, well, if you're trying to juggle 2 jobs at the same time, look at you working for this company and getting paid a little bit more. You should probably drop the other job and just work overtime for this company, and then you'll get overtime pay. If you're going to work that many hours, it just mathematically makes sense. And I felt good about this person making that decision and staying with the company and clearing out her hours from her other job and working for this company. Because of what she saw, me getting, slightly punched by a guy about my size, she finished that shadowing shift, and she called in and quit. before she ever put this uniform on. Before she put any of the uniforms that we use on. She quit. I'm like, what? She didn't give me any indication like that, but I guess it's not a job that some people can do because it's scary, I guess. I tend to think that workplace violence can happen just about anywhere. It happens more in healthcare fields and social work especially. But not so much from people who have mental disabilities, more from bullies who game the system, who try to get more out of the system by using violence or tactics that make people feel uncomfortable by being loud, And you're going to see that in a lot of different fields. So being in behavioral security wasn't something that exposed me to any more violence than I think just being a nurse would. It's especially less than probably being a cop. But yeah, this is the last video that I'm making for this series. This is actually the last time I'm going to wear this shirt. Awesome. Taking it off right now. Reason why is I accepted a different position with a different company. And it's not that I really didn't like the company I was with. It's just about professional development, So, that's the end of this. But the reason why this is the last episode of this series is because I signed a confidentiality agreement with my next employer. The reason why is because I'm going into providing therapy for certain clientele, and part of my confidentiality agreement goes a lot farther than even the law would have, but it's probably trying to cover all the bases. But I can read a little bit of the agreement itself. I can't talk about identity records, which would identify who is in the program. That's something I've never done in this series. But also prognostic records, which is different. And that would be anything that would explain what treatments would help the client, and diagnostic records, and treatment records, just attendance and physical whereabouts information, like just saying that I work at a place where there are other people, and there's this one individual who stood out today. That's something that I've actually signed paperwork saying that I won't do. My next job requires a little bit more confidentiality out of me than my previous, and it's just part of moving up as a therapist in behavioral health. And if I do talk about my job again, it will be in vaguer terms. It won't be about specific clients, because I can't. People trust that when they go to receive certain treatment, that their stories aren't going to get out. And in my previous job, I got to tell you guys a bunch of wonderful stories because I wasn't beholden to such confidentiality requirements, but now I am. And so this is the last of this series, and hopefully it will give birth to new series as I find ways to vaguely talk about my job, or just find something else to talk about. It's been great talking about this job. I hope you guys enjoyed it. That's a wrap.